welcome to this webinar on creative health and children and young people's mental health. This is the first in a new series of webinars that we're setting up specifically targeting health and care professionals. So I'm Jayne Howard, so I introduce myself. I'm Jayne Howard. I'm the Programme Manager at the National Centre for Creative Health. And these webinars came out of the work that we did over the last 18 months or so with our Creative Health Associates programme. And one of the things that was identified as part of that programme was more opportunities for time poor health and care professionals to get together and have some very short focused opportunities to share experiences around creative health and to talk to each other as peers. So this is the first in that series. Our next one is in October, and I'll say a bit more about that at the end of this session. I'm delighted to welcome our speakers today. We have got 4 presentations lined up with 5 speakers in total, and I'm particularly grateful because I know some of them are coming to this when they're actually on leave or they're in an away day and they're taking time out to come in and share their experiences with you today. So thank you to all of them. We'll go through each of these presentations and we'll open up for questions at the end of all 4 presentations, because otherwise I know what will happen. It'll overrun and the last person will have about 2 minutes to present. So I think without further ado, I'm going to hand over to our first speaker, who is Kat Taylor, who's Senior Clinical Psychologist at Lancaster and Morecambe Specialist Services Network, but is going to talk to us about work at the Greater Manchester, when she was at Greater Manchester. And I'm doing the slides for this, so I'm going to open those up now. So I'll hand over to you, Kat.
My name's Kat. So I'm a clinical psychologist in Lancaster and Morecambe CAMHS, Child and Adolescent Mental Health Services. And as Jayne said, I'm here to talk about the Greater Manchester Arts, Culture and Mental Health Programme, which was within GMI Thrive, which we began in 2019. I'm going to talk you through what the programme was, how we set it up, how we approached evaluation, and then lastly to think about some challenges and possible solutions. So the programme ran for 3.5 years until my mat leave, and it has not continued, but there has been legacy. So there are still creative health options available within the Greater Manchester Children and Young People's mental health care system.
Next one.
Yes, please. Thanks.
There we go.
So just to tell you a bit about what the programme was before I tell you more specifics. So our intention was to identify good practice, which obviously exists in abundance, link different sectors, so health and social, cultural sectors, towards innovation and co-delivery, and then to implement projects and evaluate them. And generally, we hope to demonstrate that such options are effective because of available evidence indicating so, gather more evidence that they're empowering safe and cost-effective approaches. And I would like to linger for a minute on the word safe, because I think that, in my view, both personally and professionally, actually, there's an overuse of medication, particularly among young people. And I think that that's not emphasised enough, the fact that many of these interventions don't carry side effects or can't be overdosed on, shall we say. So this is a photograph from Company Chameleon, who did mental health interventions in schools using dance. And firstly, we mapped current provision, which I'll talk about more. And we delivered a series of proof of concept projects. Then we developed a cross-sector evaluation framework, and we developed and delivered training alongside all these activities to bring the workforce with us. So if we can carry on, please. So we did this because it was within the Greater Manchester I Thrive team. This is the existing transformations of children's services. So we were able to work at a strategic level. So we had senior leadership buy-in, which we needed in the first place to set the programme up. We had partnership with cultural leaders and key influencers in Manchester, and then ground level support and training. So working with the people like myself who work clinically face-to-face with children and families. And we did this through establishing communities of practice. And again, I'll talk a little bit more about each of these. Thanks. So I'm not going to go into this in too much detail, but I thought it was really important. One of the questions that you asked me to address was how did we set this up? And I really need to acknowledge the fact that Manchester has a really long history. You've got Lime Arts in the 70s, Arts for Health in 1980 being one of the oldest, or the UK's oldest arts and health research centre. My career in Arts for Health began at Arts for Health at MMU. So I was already kind of embedded in this ecology, very rich, long ecology. And I just wanted to acknowledge that that's firstly one of the reasons why the Arts and Culture programme was established in Manchester. Secondly, if we can get the next slide. That's just an example of Lime Art. So that's their radiology department. And I think that this is from 2014. So people in the system in Manchester did have an understanding that using arts or creativity in healthcare environments can lead to better outcomes or reduced hospital stays and things like that. So there was that knowledge and understanding already in the system. So if we continue, thanks. This is a bit of a breakdown of how did we achieve it. So firstly, I said that the background of Greater Manchester was incredibly helpful and if not vital. And secondly, the fact that I Thrive exists as a transformative children's, the transformation of children's services meant that there was already a small team of maybe 5 or 6 full-time employees whose job it was to deliver training across the system. But it meant that all the deliverables and aims of the programme could be bolted on to an existing infrastructure, which was GMI Thrive. So in 2019, there was the role definition, board approval, and that was things like making business cases, bringing in evidence and examples to decision makers to try and sort of negotiate the fact that this role could be valuable. In 2020, we delivered workforce training packages, which included training artists in working in mental health settings, as well as training healthcare providers to understand the field better. We had staff ambassadors, which I'll come on to and tell you more about in a moment. The pilot projects were actually funded by a Great Place. So this is an example of where, I find it continual, and I'm finding it now in Lancashire Care, that the NHS is not in a position to fund what they perceive as innovative or groundbreaking work because we're told the evidence is not robust enough. So it might be that you need to partner with other organisations and schemes to get yourself off the ground. And then in 2021, after the evaluation kit, which is my next part, we had a system lead working group. So again, it's working with the current systems. So we partnered with public health, with school readiness, with early years, with the violence reduction unit. So we had a working group of leads from all the systems so that everyone understood that this programme formed part of our work and that everyone had a responsibility really to understand how they could bring it into their specialties. So the Bearing Foundation was how we got further funding, but then surprisingly the VRU did match fund it. And eventually it led to 6 CAMHS creative health offers being embedded after the pilots. So the pilots, reached what we hoped. And then we have 10 Arts for the Blues groups in MFT and a range of implementation stories for people. So the context being Greater Manchester, then I Thrive. And I think the third thing to say, and I say this to you as an audience, because I think that it's important to recognise that it can just be down to individuals. So in 2019, I wrote to the trust and said, do we have a creative health programme? Here's some evidence. And as a result of the programme, other people in the trust then decided to write to their managers, and that's how things can develop. So sometimes it can be down to you. That's why I say this. Okay, let's carry on, thanks. So this is an example of how we talk to the workforce. We asked people to become an ambassador. So we had over 200 people who had things like an email signature and access to the team for consultations of how they might progress this work where they are. And we basically provided tools like research digests, even documentaries, podcasts, helping the workforce to better understand what the field means and how you might develop it yourself. So if we carry on, when it came to evaluation, we recognised that essentially many artists would tell us that they didn't feel confident or even aware of what kind of tools a commissioner might use, and a lot of idiosyncratic assessment was going on that actually commissioners couldn't really use. So over the space of a year, we brought different sectors together to really get to grips with what were the issues, how to address them, and how to skill people in using some of the tools that they previously felt they couldn't access. It's such a lot to cover, but I'm trying to just give you an overview. So when it came to the evidence base at the beginning, well, we'll carry on to the next slide for now. Like I said, issues to address is that sometimes people felt that they weren't qualified to use those tools, or they didn't fit their setting. So some of the language might be too clinical. So we tried to break down some of the barriers by engaging with the people that we were asking to use them, and then develop this kit, which looks like the following slide. So people were given an Excel spreadsheet, so really simple to use. And, we tested it, and a kit which asked them to collect minimal data. So we asked people to collect things like postcode to look at areas that might not traditionally access cultural experiences, process data like waiting times, and even DNA rates, because to a commissioner, if the DNA rates are different, that's worth knowing. But these are sort of clinical approaches, and so we were trying to get the arts sector to capture some of the things that we would typically capture. So for reasons I don't have time to go into, as a group we chose, through lots of workshopping, the outcome rating scale and the short WEMWebs, and they were our key outcomes, together with an experience or qualitative outcome. If we continue, some of the challenges that we encountered. Firstly, this first one, lack of awareness and understanding, was at the beginning, I had a real mix. So some people were very keen, very eager, could see what I was talking about immediately and welcomed the evidence base, and that it might still have been developing. Bear in mind, this is like 6 years ago, when we began. But then others would use words, with a memorable word that I heard in a senior meeting with influential decision makers. The arts are just fluffy and they're just nice to have. So I think there was a misperception that their effectiveness is maybe more prominent at the sort of lower end of severity, that it's useful for prevention, but it's not where serious issues or presentations are present. This is not the case, and it took examples of services such as in Manchester or in Salford, we have Unity Radio, which is now commissioned by the CCG because of their incredible work to demonstrate that young people with complex or risky presentations who might be missing from home or they disengage from CAMHS, they can benefit from more innovative interventions like music, like radio production. So in Thrive terms, it was helping the system to see roles for creative health in all the quadrants, including the getting risk support quadrants. The fella who said it was fluffy, we did not manage to change his mind through research review, systematic reviews or examples of reductions in criminality and things like that. And after a year of the programme, I was told that it was going to be discontinued and that I'd be made redundant, and I just kind of had to accept that. However, there was a surprise turnaround, and it turned out that the reason for the turnaround was that he'd had a personal experience. I think it was to do with a theatre or a radio drama, and he sort of had a realisation that he used arts and culture as a route to his own well-being. And so, as a solution to one of these challenges, I think one of the quickest way to, I'm going to say, change hearts and minds, is to give people an experience. Bring artists into your training and give people an experience in a workshop setting, or ask people to reflect on how their engagement in arts and culture affects their health and well-being. I've touched upon the lack of funding for innovation, so I think you might have to look elsewhere, but I feel like the NHS ultimately needs to invest in these now that pilots and pilots and pilots have been done. Overwhelm of clinical teams. So this is my last slide, I'll just let you know. The lack of capacity, so bringing in maybe unfamiliar concepts or unfamiliar ways of working, unfamiliar settings, people that you've not worked with. We really had to get out there. So this mapping, the sort of mapping scoping at the beginning, we asked people, what's your view on creative health? What do you think we could do? Do you feel like you are receptive to it? So we went out there and we tried to ask people what are the barriers, and we tried to find out what the barriers were and then address them with those people, rather than trying to do a survey of busy clinical teams. You could send the link to team leaders, but we didn't get a great response. So I would go out to teams with psychology assistants, get a slot at their meetings, get the manager to say, give us a slot and then give us 15 minutes so we can all complete the questionnaire together. Otherwise, it doesn't happen. And then spreading the word by changing the culture. And this was, you know, the signature and the existence of the programme gives people permission to actually make changes. And several people in the system went to their managers and said, can I, in my job role, can I have half a day a week to be a creative health lead and champion and try and link with different sectors? And that was successful in several teams. So I think the last thing to say is that it's all about relationships, which is obviously the case, but many sectors, but really trying to listen to, because it's such different audiences. And for some people, this is kind of like hiding in plain sight. And it's something that, even though people might, I've had people say, what's art got to do with health? You know, but it doesn't usually take very lengthy conversation before people get it. So thank you for asking me to talk today. I will end it there and look forward to the rest of the session. Thank you.
Thanks so much, Kat, and I think that was really helpful. It's a lot to cover, I know, but in terms of just giving us that sense of, you know, what the steps are that you need to take, that whole thing about building on relationships, looking at people's personal experiences of or lack of experiences of this and what they need in order to feel you know, that this is going to be something that will work. You know, it is different for everybody, isn't it? Some people are convinced by the systematic reviews and the evidence. Others do need something that's more bespoke for them. So yeah, thank you so much for that. I think that people find that really helpful. We're going to move swiftly on to Anne Tan. Anne is a senior art psychotherapist at Sandwell CAMHS.
And it is really just visual clue to help everyone to see what I'm trying to share. So I'm going to start with how what does that look like in the therapy room. So normally when the young person came to me, we will have a think about what is it that we are working with. So the slide that I'm showing you right now, it's actually the one that I will be presenting to the young person, and I'll invite them to think about the first. It is mainly emotions that we are working with, and I found these visual tools serve as like an invitation for them to think about what emotions or feelings or even experience that they are bringing into the room and what are the ones that they are seeking support with. And then we will then move on. So the next slide about how we're going to do it. So in our art therapy room, we got different sort of materials. I would normally invite them to identify the one that they found interested in or the one that they found maybe it's new much of them, but they are interested in trying. Sometimes we would have young person that might be a bit scared about trying new things or aren't as familiar with art making, but then that's another chance to kind of challenge them to step a bit out of their comfort zones and try something new with me. And then eventually the third image shows that's kind of like our goals. That's where we're trying to reach, is to come to I would call these like the light bulb moments, which is when in the art making we might be able to gain new insights on the things that we might previously stuck or feel hard to think about, or it might be new ideas or new kind of creative ways that we came up in the process to help manage the difficult feelings that we have. And then I'm going to move on to the next one. So apart from the light bulb moments, here are also some of the benefits that I found bringing art into therapy. Is the artwork itself also serve as a safe container for the difficult feelings that young person might be carrying, or the hard experience that they found it hard to verbalize or hard to think about. And by using objects, a safer, it provides them with a safer distance to kind of have a chance to look at it and have a chance to think about things in different ways. And the third image is about the joint eye contact that a third object, in this case, would be the art making, offer into the relationship. I think in CAMHS, in my experience, a lot of my caseload, a lot of the young person that I work with are neurodivergent, and they often found like one-to-one engagement sometimes can be a bit confronting or a bit intrusive. And by inviting art into the space, we can then have this joint eye contact, think about things together, that ease some of the pressure for them and also support with their engagement. So this is what one of our art therapy room actually look like. Normally we will have the art cupboard full of different kind of art materials. Depends on the case. Usually I would prefer to have the cupboard open for them to have the rights to choose the materials that they want to use. But at times I might have to be more cautious and select a certain amount of materials for them. No in the room, and also a round table. To the idea of the round table is kind of offer like there is no sitting across, but it's we're always like sitting next to, sitting alongside to the young person. So that's a bit of brief sharing of my experience in CAMHS as an art therapist. Lastly, I wanted to show you an image of an exciting project that we had in Sandwell last year, which is from the hospital room project. So they came in and then renovate the whole building, inviting a whole bunch of art, different kind of artwork to transform the space. And throughout that period, they also offer different kinds of art workshops for young person and family that comes into CAMHS. And in that experience, we got a lot of good feedbacks from the young person. Definitely changed a really ugly old building, almost scary to a point, into somewhere that is really welcoming. And also in the art workshop, young person, they got a chance to kind of find their own voice through making art, sharing their artwork with their family, and that also boosts their confidence. And with all these lovely artwork in the building was part of my role. I also do assessment for the young persons. Often they would find it quite nervous coming into a new area or a new space, but sometimes they got curious about the artwork, and along the way we started to have conversation around what that image might look like or what that color might reminds you of, and that kind of removes the stress from them a little bit and prompt a better engagement in that assessment. So I'm gonna stop sharing now, and this is the end of my presentation.
Great. Thank you so much, Anna. It's a really great reminder there of really the value of this work for individuals and also the importance of the hospital environment. I certainly know places where hospital rooms, and we can send people a link to that if they're not aware of it, has really stimulated an organisation to think more broadly about the role of creativity in the arts within the hospital setting, where having sort of an external project coming in like that can help to kick things off. So thank you so much for that. Great. I'm going to move on to our third presenter, David McQuillan, who is Creativity and Health Programme Manager at South West Yorkshire Partnership NHS Foundation Trust. And David is joining us on an outside broadcast today, it feels like. So I'm very grateful to you, David, for coming along. And again, I'm going to be doing a
couple of our projects, and I'm talking just about a couple of projects, partly because they're the really interesting thing about what we do. But one of the ways that we have found that we have most success embedding our creativity and health work across the NHS is when we address some of the tricky issues, some of the knotty problems that services can't deal with in any other way. And the other way is we've been very successful at bringing money in from outside to run these projects. And actually we found the best way to kind of, as Pat was saying, win people's hearts and minds and get on people's radar is actually to get in there and deliver the project. And then along with the evidence, you have those photos and videos of what you've done. So I started working in Calderdale, just one part of West Yorkshire, 4 years ago, and the post was only for 1 year. But in that 4 years, we've raised over £2 million, and we've expanded the team to like 3 people. And most of that has been things like I'm going to show you now. So actually getting in there and kicking off projects and showing people the results of them like this. Even before, like in these two, one of them we haven't got the evidence yet. The other one, we haven't actually started delivering the project yet, still in the kind of funding process. So Jayne, if you move on to the next slide, please. This project I'm talking about is the first time we worked in one of the acute trusts in the area. So we worked with the children's ward in Halifax Hospital. So the tricky issue that they presented us with is that pre-pandemic, they had amazing kind of friends and family feedback and really good experience and kind of recovery rates for their young people. And after the implementation of infection prevention control rules in the pandemic, all those things changed and that feedback really dropped off. We raised some money from youth music to take some music making into the wards. And actually, like all our projects, we ran it as a co-production project with the young people. And when you get to see the images, you'll see some of the kind of amazing things that they came up with. So we run all our projects through co-production, but when we're working with children and young people and bringing them together with artists, the results are like spectacular, but spectacularly weird as well. So from that original proposal, where we were creating a music making project, what we ended up making was an immersive music making game. So the children worked with artists and storytellers, and they reimagined the hospital the way that they wanted to see it. And they created this game where their character goes through the hospital. It encounters lots of other characters. That's great, thanks Jayne, along the way. So they've all been invented by them. So one is the national elf, and then there's Nurse Auntie Lockhart, and there's a variety of characters. And as they kind of go through, so if you can move on to the next slide, you'll see an image of the game. They have to solve a number of puzzles to heal instruments. So there's like a 6 sousaphone and a pulley piano. And as they heal each one, they unlock some musical samples that they can use to create music on the wards. And then through a kind of little hospital radio app, they can share that with other people. If you move the slide on again, please, Jayne. You can see some of the character development there. And if you move on again, I think I'm just going to share one quote. We've got loads of kind of quotes and feedback from people in this project. But one that really stuck with me was a parent who said to us that we will sign anything that you want to and write anything you want to for us. Like their little girl was anxiously awaiting surgery. And this was the first thing they said that had stopped her asking about it, that had calmed it down. When we spoke to the hospital originally, they were seeing more and more mental health patients at younger and younger ages and with longer and longer stays. You can see that outcome one on the screen was very much around the funders and people engaging with music and having music making opportunities. But if you move on again, Jayne. We're now tracking outcome 2. So we're looking at the impact of this intervention on the use of medical sedations on the ward, particularly for people on the ward with mental health conditions. So far, we've had an incredible reaction to the outcomes of this project from parents and from children alike. We're in a testing stage now, a beta testing stage before the app goes live. But even at this stage, we've had interest from other NHS trusts about scaling this work across the different hospitals. And we're talking to our development team about how that works and how we use the maps of different wards. And we create almost like a Marvel cinematic universe of these games, so people can play games from different hospitals and they all work together. I think We also, alongside this project, have put a number of the staff on the play team through music education courses. So we always try to leave a legacy. So the app and the game itself is a legacy that will endure in the hospital. We'll make some kind of physical transformations to the space for the characters that people have created, and then leave a legacy of kind of trained staff to deliver and monitor the outcomes over a period of time. So Jayne, if you can move on to the next section. Yeah, so that's the next step, that's fine. If you move on to the one after that, I'm just going to talk briefly about a project that we've been developing with CAMHS in Wakefield, because there's been some interesting learning from this on the co-production even at an early stage. So, as I said, we're at the stage of a second round funding bid for this programme. This time, the tricky issue that they came to us with was a familiar one to most people, which was around children and young people on CAMHS waiting list, and what we could do to ensure people stayed well, or found something that might aid their recovery whilst they're on the waiting list, about waiting well. We've got a number of adult offers that we tried out that we are co-designing versions that would work for children and young people on the CAMHS waiting list during this project. So one of the first pieces of information we got in terms of that co-design process was around the importance of a tiered approach. So that all those young people on the CAMHS waiting list are different. So we are putting together an approach that works with an app that we've created ourselves from one of our other projects, which works like a creative version of Couch to 5K. So already it's got 4 courses of content on there on creative writing, drawing, dance and movement. And it's totally free for anybody to use. People download it and it guides them through 30 days of content from organisations that help them develop a creative practice with wellbeing at its core. So through this project, we're going to be developing content with children and young people that's specifically for them and to help them whilst they're on a CAMHS waiting list. There'll be a level where there's an activity pack that children can be sent out, and there'll be online sessions and then in-person sessions that we've already delivered with different cohorts of people with youth justice team and safe welcome after prison that have shown really good results. As we move on to the next phase of this, and I think one of the points to talk about that might be of interest to people setting projects like this up is we're working with young people directly, and we're working with the CAMHS team within South West Yorkshire NHS. Even having all of those people on this project, it's proven to be a really challenging one to get all of the kind of staffing, capacity and governance in place for. So children that are on the CAMHS waiting list, they might have had an initial assessment, but then they're sort of in a bit of a liminal space. They're not with our service, so they're not on a caseload. It's really difficult actually to work with them and maintain a kind of proper safeguarding, have the right staff in the room to ensure that if there's any escalation needed, that we've got that. So that's the stage of that project we're at. So I think some of the takeaways from the work that we've done, we talk a lot about our projects rather than the kind of strategic impact that we have. And although that is a significant piece of work, in that we've managed to embed creativity and health in all of the regional strategies, so our place is kind of embedded. It is talking about the project to the people that they're going to benefit and telling them what they're going to gain from it, and then bringing funding in from outside. So again, we're bringing in external funding for this project, and being incredibly mindful of the different issues that you're going to face and how long it takes. All of our models of co-production have produced these incredibly rich, imaginative projects. And we were so lucky that youth music kept extending our deadlines. We worked with really flexible funders, because that co-production process and working in such an acute setting meant that it took about 3 times longer than we thought it was going to take. You have a number of times on the children's ward where the level of acuity on the ward or the capacity of staff was just such that we had to delay whole phases of the project. And the same with Wakefield CAMHS. It's taken us a long time to work with capacity, see if we can bring some in from project funding and what the NHS can contribute themselves. But obviously key, and I think, Kat, you mentioned this as well, that word safe is about making sure that the project is safe, as well as ensuring that it has those kind of beneficial impacts for children and young people. So Thanks everybody for being with me. I hope you could hear me over all the drumming and the noise at lunchtime.
Great, thanks. I think what's been really interesting just so far is just, you know, the sort of emphasis on the importance of these things take time. You know, they're not quick to get off the ground, but almost if you want them to be sustained and sustainable, you know, it's worth that investment of time at the outset in getting the right partners on board and really sort of understanding what it is you're trying to achieve with the program and how you're going to know when you're there. And that co-production process that we know takes time, but can be you know, is just so important for this work. I'm going to move swiftly on now to our final presenters. I know we've got Hermione here, Hermione Roy and Stephanie Wallace. I don't know if you're doing a double act or each of you are taking it in turn. So yes, there we are, double act. And again, big thanks. So Hermione is consultant psychiatrist at West Cornwall CAMHS, and Stephanie is a dramatherapist at Cornwall Partnership Foundation Trust, also working in CAMHS, I believe. And I think you're taking time out from a team away day to do this. So very grateful to you for that. And I'll hand over to you. We had a number of technical problems this morning.
Yes, yeah, and we don't know whether we'll be able to get the photos up, but hopefully we can.
Yeah, are we able to share, or should we send them to you guys?
We'll
share.
maybe we'll try and
You should be able to share.
Not got much time.
Be able to.
Yeah. Yes. I'll start talking anyway. Basically, this is a really small project compared with the sort of impressive things other people have done, but it's had quite a big impact, I think, even though it is small. And originally it came from an audit that I did, because the state of the building was terrible at CAMHS. I sort of just started, there was no participation, came in the building, there were stains on the floor, the seats were ripped. Did an audit, and two main things came out of it. One that was people enjoy being seen outside, and the other one was about the art, that young people didn't necessarily mind the art, but they found it a bit strange and they wanted more of it. So we thought what would be good is if we could marry the two together and have some more artwork and actually get the young people involved in making it with us. And I think we were very lucky, really, in that Jayne sort of talked to us a bit about grants, let me know. So I applied for a grant, we got that, and worked with a couple of artists who were lovely at Red Roof Press. So that involved me going and meeting the artists, and they really helped us sort of formulate what we could provide given the money. How many workshops, the timing, sort of told us what they'd need from the venue as well, and also helped us sort of think a bit about the sort of message that we wanted. And it was really around young people thinking about what would be useful for their well-being, what do they use, and what's good for their mental health. And they came up with a poster, which we sort of sent around sort of by email, put it up everywhere, got everyone in CAMHS to sort of talk to young people, see who might be interested. And and got a few young people involved.
So we got to do a couple of days. One of them was actually in our clinic space, so the young people came, met the artists, thought of their ideas, things that helped them, whether that was reading that they really enjoyed, or like swimming, and they created these posters using the screen printing, and it's just like an amazing opportunity, really. The artists were amazing with the young people, really inclusive in their approach, and also just facilitating the making of the posters. So we did one in our base at Belifo in our clinic space, and then one in local college. So then that was quite nice for arts kind of connections with the wider community as well. And yeah, then we had a little event, didn't we, where we cut the ribbons. I've put the slides up. I don't know if you can see them or not. We can see them, of the images.
We can see them.
Yeah, we can see them.
You can,
right.
Yeah, so, and I think the impact of the kids actually coming and doing the sessions, I think because the posters are so striking and so like impressive, it was a really nice experience for them to do it, have their message, and then we've decorated the clinic spaces as well, haven't we? So It's been a great kind of impact, you know, families. I think when Anne, you were presenting as well, you know, your clinic corridors and things, we do the assessments as well, and quite often it just generates lots of conversation. Oh, that's really nice, and you get to say about the project we did, and that it's actually young people's artwork on the wall as well.
Yes.
So,
and I suppose one thing it did as well was it helped kickstart the participation group.
Yes.
Which we didn't have beforehand.
Yeah.
So that's and it's a talking point, so it makes it easier to refer to it and then talk about the participation group as well, isn't it?
Yeah, 2 of the girls actually who came to do that project are really important in the participation group now, and they've done loads of stuff like with changing our clinic, and I think that initial workshop has given them the confidence to come to the next one. So yeah, that's been a really useful experience. Yeah.
Yeah, and I suppose the other thing to mention was we were thinking about this already for the young people and what will be useful, but actually it was so nice to actually sit in a group ourselves as members of staff and not be talking about young people's problems, and doing something alongside them.
With them.
And it was sort of good for our morale as well, wasn't it?
And actually, we had a couple of weekends afterwards as well, where we put them on the wall, like kind of pasting them onto the wall, and then we cut out mini versions of them. So it was nice for the staff as well to change that space that was a bit kind of dull in some areas before. Yeah.
And so I suppose this is the opening event where we cut the ribbon, and then nice. Had some confetti, and then the poster wall, which has really brightened the area. Hasn't it? So how do we come out of this?
We can stop sharing, and then we can see everyone's faces again.
Brilliant.
Great, thanks. Do you want to say a little bit about the participation group? Because that sounds like a really interesting outcome from this, which is unexpected, maybe.
Yeah, can do. So our colleague Sarah has been running them, and she sort of has a rota of other clinicians that join her. Quite often they've got a theme. I think the first theme was that the young people had talked about their experience with GP clinics and feeling quite validated by some of those initial conversations about their mental health, like before kind of having that initial appointment with CAMHS. So they wanted to feed back some of that to the GPs, which I think one of our nurses has kind of helped to facilitate. Another part of it was they felt that the clinic space, in particular our waiting room, just wasn't really fit for purpose. They felt like it just wasn't very child friendly, or the things that were child friendly were kind of not adolescent friendly. They were more little people, and they felt like actually we'd like some things that we can look at, you know, be that teenage magazines or I don't know, colouring books that are more age appropriate. So they've done quite a lot of work in feeding that back. One of the young people wanted like stimming boards, so Sarah's found some of those on Vinted. So there's more kind of bits and bobs for them to look at in the waiting room, and it's more colourful as well. Like we've got your rug there, and we've got different things for them to look at. Like Sarah printed out nice posters that weren't like the kind of NHS messages that have to be there. That seemed to be the focus initially, but now that's mixed up with those things that kind of have to be there, plus nicer posters about well-being or about community events that are happening. So there's been quite a lot of work going into that, and that was really led by the young people. I think, and we talked together, didn't we, about sometimes those participation groups needing like a focus, and I think quite often that has been arts based to sort of, you know, draw them in and have that, like a lot of practitioners talked about today. It's really helpful to do something alongside young people so that they're there for a purpose, and then, you know, while they're making something, quite often they'll chat about how things are like internally for them, even though it's not a you know, structured therapy session as such, but it's therapeutic in its benefit. So that's been really great.
Yes. And I think that's something that we're really noticing with the young people that come to CAMHS. Is one of the main issues is loneliness, really. But at the same time, it's very difficult to get them into a group or to, you know, any youth clubs that are out there. So anything that sort of helps that is, I mean, that's something we're thinking about now, about where can we go next, really.
Yeah.
So,
Great, thank you so much. I think that's been really interesting. You said, Hermione, this is a really tiny project, but this is what we've heard is that things start really small, and it takes time for things to grow. And I know that there is interest in the trust, in developing work further across the trust as a whole, but hopefully, within the CAMHS services as well. We had, I think we had a question for Kat about, yes, this was from Sarita. At Cambridgeshire, I think it is. I can't see the whole slide. Anyway, mentioned speaking to commissioners and people at the top to build a case if there is limited evidence. Do you have any thoughts how we can navigate this in the context of the current mental health support teams rollout, given the emphasis on CBT, talking therapists?
It doesn't need to be either or. They're not mutually exclusive, are they? I think that one of the things that I'm advocating for, and that you can see in Arts for the Blues, is that CBT can be augmented by the use of creative engagement or having artists in the room and making things more playful, more age appropriate, so that people can get the most out of it, so that each sector can benefit from the other. And then the second thing is just to say that CBT does not suit everyone. And if you look at the outcomes from the Anna Freud Centre tells us that 1 in 2 children who go into CAMHS do not improve. So what are we doing for the 1 in 2 for whom CAMHS isn't working? And is creative health part of the answer to that?
Right, thank you. There's a question for Anne, I think question of clarification. What age are the children that you work with, Anne? So Ruth's asking that question.
Yeah, so for us, the service is up from 0 to 18. Personally, I work from 6 to 17, but that is just based on the caseload that I've got assigned. We've also got a separate 0 to 5 team within the team. As far as I'm aware of, no art therapy involvement at the moment, but there could be collaboration.
Okay, thanks. We've just got a minute, and I'm determined that we will finish sort of on time. So we've got a couple of things that we can follow up in the Q&A where people have asked for more information. I'm sure we can pick that up with David and Kat after this, if that's okay. And we'll be circulating the presentations from the presenters. So just a real final thank you all for coming along today. Apologies for all the technical hitches. But hopefully you still got something out of that, and thinking about where you are on your journey with creative health in your CAMHS service, if that's appropriate. What can you learn from this? What hope it's inspired you to continue if you're finding it quite challenging. And a final big thank you to our speakers today who've taken time out to come and share their experiences. Been really helpful. Our next webinar, I said this is the first in a series, and our next one is on the 15th of October. We'll make sure that you get the links for that, and that's going to be focused a little bit more around the 10-year plan and the opportunities for creative health within that. So quite a big broad focus for that. And then we're having another one in December, which will be looking at neighbourhood health and the opportunities for creative health as part of that. And do sign up to our Health and Care newsletter if you haven't already, and encourage your colleagues to do so too. Brilliant. Thank you all so much, and hope to see you again. Thanks again. Bye.